Whilst you're having chemo or radiotherapy here at the hospital, you will be given a parking permit which entitles you to park for free at any of the spaces in the hospital. If you're having treatment at other hospitals, please be sure to ask what entitlements you have as far as reduced fees go for parking. You may well be entitled to a blue badge, which makes parking a lot easier in hospital and outside of hospital. You can apply for this yourself, or it may be that we can help you do this on a fast-track basis. If getting to and from your appointments is an issue, you may be eligible for patient transport. Do ask for details if this applies to you. If you're lucky enough to be able to travel once all of this is over, please bear in mind that you do need to ensure you have adequate travel insurance in place. Not going to dwell on this at the moment because it's not relevant for most of us, but please bear it in mind for future use. If you're not already exempt from prescription charges on grounds of age, your cancer diagnosis does provide you with an exemption certificate. This applies to all medications, not only those to do with your cancer diagnosis. Your nurse will fill out a prescription exemption certificate. We stamp it and you need to send it away to get your card. This is valid for 5 years and can be renewed as many times as is necessary. Making choices about work, it is important to realise that with a cancer diagnosis, you do have a degree of legal protection as far as your employment goes. Your employer has a legal obligation to make what is termed as reasonable adjustments. This might mean reduced hours, flexi time, or working from home. We have got a Macmillan booklet that gives you far more detail on this, but if you need advice or are having problems with this, please do contact us or the Macmillan Citizens Advice Bureau. Something that we urge everybody to do sooner rather than later is to make contact with the Dorset Macmillan Citizens Advice Bureau. The team at the Dorchester Citizens Advice Bureau have been specially trained and they know all the ins and outs of what you're entitled to with a cancer diagnosis. In the past, we've had many people who say, well, I've never claimed benefits in my life and I'm not going to start now. Our advice would be, these are not benefits, these are entitlements. You're going through a very difficult time and this is something you're entitled to, which may make things a little bit easier. You can contact the team at the CAB either by phone or email. They will get back in touch with you if you leave a message on their answer machine. Obviously, they'll need to go through your finances with you, but by doing that, they can see if you're eligible for any other entitlements, and they can also help you with things like cashing in health insurance policies or settling mortgages or other loan repayments. The Macmillan team may also tell you that you're entitled to put in a claim for a Macmillan grant. This is something which is done on a means-tested basis, and if you're eligible, you may receive a sum of up to £500, which can be paid once in a 12-month period and can be used for things which will make your life easier at this difficult time. For example, a new washing machine if yours has just died, or a new bed, or a chair that's easier for you to get in and out of whilst you're going through treatment. Please do ask for details. If you feel you may not be eligible for the Macmillan grant, as you feel your income or your savings are too high, there's another association we'd like to make you aware of. They're called the Dorset Cancer Care Foundation, and they can provide grants and all sorts of other assistance. The grants are not means tested, so do get in touch with them and we can give you the details for that.